The Health Ministry reported a 19% increase in hand, foot and mouth disease cases over the past week. In a statement, Health Director General Dr. Nur Hisham Abdullah said there were 18,602 cases reported compared to 15,548 the week before. Between January 1st and May 28, a total of 65,535 cases were reported.
Hachum! Adriana, wake up. It's morning already. We have to go to class.
I feel sick.
Huh?
I feel sick.
Alia!
Yeah.
Look at her hands.
Oh my gosh. I think we need to bring her to the doctor.
Hurry.
Miss Adriana, please enter room 1. Okay, Adriana, what happened to you?
Look at her hand, doctor.
Oh, I see. Do you have any fever, sore throat, sneeze or vomit?
Yes, I have all of them. It's been 3 days.
Oh, I see. I guess you are diagnosed with HFMD. You can take the medicine outside my room.
Thank you.
Okay, so this is our medicine. You can consume it twice a day.
Okay, thank you.
Adriana, what happened to you?
Adriana got HFMD.
Huh? HFMD? What is that?
What is HFMD? Hand, foot, mouth disease is an infection by the virus group which includes enteroviruses, consecuviruses, ecoviruses and polioviruses. Among these viruses, consecuviruses and enteroviruses is the most common pathogens.
Okay, so we move on to the next part is, where does HFMD disease come from? Hand, foot and mouth disease may be related to Coxsackie virus A16, A5, A9, A10, B2, B5 and enterovirus 71. Coxsackie virus A16 is a frequently encountered pathogen in cases of HFMD and its clinical course is usually uneventful with full recovery. Coxsackie virus infection are rare. Literature search revealed only 3 fatal cases of Coxsackie virus A16. All the cases were infants. The first case in 1963 involving a 10-month-old girl with respiratory infection. The second case involved a 7-month-old boy with grunting and tongue ulcers. And the third case involving a 15-month-old boy. So that is for Coxsackie virus A16 infection. So we move to the HFMD that is caused by enterovirus 71. Enterovirus 71 can be more severe and may be complicated with meningitis and neurogenic pulmonary edema. In Taiwan, based on 1998 epidemic, the significant difference in the clinical features of Coxsackie virus A16 and EV71 was that in EV71, the fever usually higher than 39 degrees Celsius and is usually longer than 3 days. Most HFMD cases occur in the summer and fall, and its incubation period is 4 until 6 days.
Back then in 2022, there are 31,622 cases were recorded in Malaysia. Most cases of HFMD affect children between the age of 6 and below. According to KKM, Kementerian Kesihatan Malaysia, there are 9,822 cases were recorded up to 13 May 2023. This raising concern among the public, especially the parents, as the disease can result in death among kids.
Widely known that HFMD is mild but highly contagious viral infection. It is commonly affect the children below 10 years old but can also affect the adults too. The transmission of HFMD can be classified into two types of transmission, which are direct contact and indirect contact. Direct contact is when the person that is infected is in contact with another people. The example of direct contact is by coughing, sneezing, fluid from blisters, infected saliva, mucus, and stools. Next, we move to the indirect contact. Indirect contact is meant by HFMD can be spread by touching objects or surfaces that is contaminated with the virus. Thus, children that are in nursery settings should be extra invigilated because the potty training, the frequent diaper change, and sharing clothes, toys, and eating utensils can spread the virus rapidly.
The symptoms are rashes around mouth, foot, and hand, fever, cold, sneeze, vomit, sore throat, and ulcer.
To make diagnosis, the doctor will evaluate the age of the affected person, the pattern of signs or symptoms, and the appearance of rash or sores. This will help aid in distinguishing HFMD disease from other types of viral infections. To determine the strain of virus that causing the illness, the doctor may take a throat swab or stool specimen and send it to the laboratory. Early detection of the infection is important in preventing an outbreak in the pediatric population.
No specific treatment actually exists for the infection. However, there are some helpful ways to reduce the pain. Firstly, if you have fever or any discomfort, you can use paracetamol as suggested by the doctor. Secondly, avoid spicy or salty food. Thirdly, avoid acidic food and beverages such as orange juice and soda, which may cause pain with mouth ulcer. Lastly, you may rinse your mouth with warm water after meal.
How to prevent HFMD? HFMD is a very contagious disease to babies and even adults. So, there are 4 main steps to prevent this disease. Firstly, always wash your hands with water and soap for at least 20 seconds. Always wash your hands after changing diapers. Always wash your hands after going to the toilet. Always wash your hands after blowing your nose, sneezing, and even coughing. Plus, always wash your hands before and after taking care of someone who is sick. Secondly, avoid close contact with people who are sick. Avoid touching, hugging, and kissing them, especially kids and toddlers. Kids can still go to the daycare if they have no fever, no uncontrolled drooling with mouth sores, and can participate in the class events. Thirdly, avoid touching your eyes, nose, and even mouth. Lastly, clean and disinfect frequent touch surfaces, and including toys.
Let's prevent HFMD.